We're starting right now.
Hey, everybody, Dr. Rob Silverman here. We've got our Facebook Live. We've got LinkedIn Live. I've got Dr. Eric Rees here. We're both out in Utrecht in the Netherlands, and we've been presenting at the ECU, the European Chiropractic Congress. And Dr. Eric, how are you this morning?
Hey, I'm doing well. That's funny. Rob and I are literally sitting right next to each other, which is amazing. So yeah, we're going to bombshell each other. It's been a great weekend so far. There's been a lot of amazing speakers. There's been a lot of amazing content. I think one of the things that continues to reign true is that there's so much that we still have to figure out about understanding the brain, the body, the metabolic system. And more importantly, too, one of the things that we're really keen on is trying to find ways to help our patients to be able to build an effective practice, to be able to help people find healing. And Dr. Rob's had some amazing presentations this week that I'm excited to touch some points on. And what we're really passionate about right now is getting the message out there about something that we both believe in, which is utilizing low-level laser therapy. So, Rob, you did an amazing presentation yesterday. I think it would be really nice for the viewers just to get a little bit of a deeper understanding of what we're talking about when we're saying low-level laser. Like, what are we actually meaning when we're saying low-level or non-thermal lasers?
You know what? Without question, that is the number one question that we get asked. We got the man behind the scenes, Dr. Simon Ramshaw, and it's a fascinating question. What is non-thermal laser, low-level laser, photobiomodulation? Well, number one, it's not heat producing. There's so much data out there. There's so much confusion out there about what's hot, what's cold, what's cool, what's not cool. So you and I both adhere to the concept of we want to use a laser that has no deleterious effects. We use lasers in the proper wavelength. The two wavelengths that we really discuss are 635 and 405. So it provides a non-heating wavelength to tissue. We're using something that provides photons to specific areas of the body. In those photons, it allows for electromagnetic transfer of energy. Now, you referred to a couple of talks that I did yesterday. Thanks for the kudos. I really appreciate that. Number one, interestingly enough, we talked about musculoskeletal applications of non-thermal low-level laser. We did an emphasis on the shoulder, and we talked about its immune function, especially with long haulers. And let's dive in there. Incidentally, we're going to talk a lot about the brain today. Dr. Rees is an expert in functional neurology. So, Eric, if I may, let's just pick it up. Let's talk about some of the musculoskeletal things you do in your office and some of the advantages patients have. And just before I do it, I always like to give a shout out. Coach Basella, how are you? I appreciate that. That's great. And Garrett, thanks for coming on. And by the way, I said this morning because I'm still on Eastern Standard Time. And Eric has made the conversion because he's living out here. So he's on European time. So if everybody's wondering why I'm speaking a little slower or a little faster, it's that change in time.
Jet lag is a real thing. Jet lag is a very real thing.
You know, it's funny you just said jet lag because we were talking about that yesterday. When you go from west to east, it's more damaging than going from east to west. So going from west to east, it's like an hour and a half. So for instance, if I travel 6 hours, I need an extra 3 hours of sleep, which you never get. And we were talking about this yesterday before we delve in. We were talking about what? Melatonin. Mm-hmm. Nothing better than melatonin to help you get a good night's sleep after traveling, 3 to 5 milligrams. But let's pick up that musculoskeletal. Let's talk about that shoulder.
Yeah. Well, I think one thing that's interesting with a lot of the patients that come into my office is, yes, we're dealing with the shoulder. Yes, we're dealing with a lot of like musculoskeletal orthopedic issues, but we also have to understand too what's going on with the brain. And the analogy that I use in my office that really hits home for a lot of patients is if you had 3 friends that went to the same party, metaphorically speaking, you would expect those 3 friends to tell you the same story about what's going on with that party, right? What time it was at, who was there, where the event was held. I mean, some of the basic details that we would expect to be pretty consistent. Well, when we're dealing with trauma, and specifically my focus and what I'm talking about is we're dealing with concussions, we're dealing with brain injuries, we're dealing with post-auto whiplash. I mean, things that are actually having an effect on the body, but also on the brain. You have to have those 3 friends go to the same party and tell you the same story. And what are those 3 friends? Well, friend number 1, muscles and joints. Right? We're talking about proprioception. We're talking about kinesthetic inputs into the brain and body. The sensory system really drives the motor system. And so your muscles and joints are so important for your brain's health. There's a reason why babies move in the womb. It's very therapeutic. It's driving brain development. And this is one of the reasons why gravity is our friend. It's always activating and stimulating our brain in some way, shape, or form. That's why when astronauts go to space, they can't stay for very long. They have to have this continuous drive and this continuous input of information going to the brain to keep the brain healthy. And so system number one, muscles and joints. And I'm going to let Rob touch more on the shoulders and the musculoskeletal that we talked about yesterday. But system two, we got to talk about vision, right? This is more than just saying we can see clearly. Can you keep your eyes focused on a target? Can you visually track something that's moving in your environment? Can you selectively pick and choose what you want to look at? More importantly, can you orient yourself in space, right? Things that are moving past us as we continue to move and walk and have different types of interactions with our environment. The brain has to understand how to process that. And the third friend that goes to that party is your vestibular system. This is a system that is specifically dealing with your vestibular system, dealing with the graviceptive system, systems that are always giving you input about where you're at in space based off of gravity. These are the systems that allow you to feel like you're moving when you're on elevators and escalators. And so these are the three friends that go to the same party, and they're always telling your brain information about what's going on. The problem with trauma, the problem with concussions, the problems with brain injuries is that those three friends can go to the same party and they can tell you completely different stories. And so what happens? Well, the brain's confused. Now we're dizzy. Now we've got brain fog. Maybe we've got pain. We've got some sort of central inflammatory process going on. And this is what manifests with a lot of symptoms, neck pain, head pain, dizziness, dysfunction, cognitive delays. And so there's so much to unpack in that. That's a big, general, broad overview. But I think one thing that Rob did really well yesterday is breaking down the shoulder. I'm not a shoulder guy. Those are the things that I refer out to smarter people like Dr. Silverman. So I'm going to throw the ball back to you, Rob, for you to elaborate a little bit more about.
I'm going to shoot it.
Yeah, well, you're a basketball guy, right? So there you go.
You know what?
I want to throw that to you.
I want to piggyback on the concussion because that's a great topic for us. And it's a great topic for you to even expand on some of the things I'm going to say. So, for instance, you gave a great three friends at the party type of deal. Yeah. So I adhere to 5 things and chime in. Number one, musculoskeletal. Absolutely. What I found in the data indicates that the upper cervical spine is most implicated, especially the rectus capitis posterior minor in the occipital triangle. It's because of the myodural ridge and its parallel formation. You gave a great dissertation on vestibular and proprioception, so I'm not going to really touch that. Laser, I think we got to dig into the laser. The data is robust on laser. Arconia's laser, the red light, the 635, has shown to help with concussions, allows for neurons, it allows for the increase in BDNF, brain-derived neurotrophic factors. It allows for, again, those neurons to fire together so they can rewire together. It creates a microenvironment in the brain of anti-inflammation. And lastly, we can talk about nutrition. I'll give you 5 nutritional supplements that I recommend post-concussion. Number one, magnesium L-threonate. Magnesium L-threonate is really shown to decrease brain aging by 9 to 14 years. It's the most viable form of magnesium to get into the cerebral spinal fluid. Number 2 would be L-glutathione, the master antioxidant, has shown to decrease brain tissue damage by 70%. In addition to that, omega-3 fatty acids. Omega-3 fatty acids are great for cell membrane. They're great for axons and neurons. The data indicates that omega-3 fatty acids are about 75% healing post-concussion, but they help avoid concussion. Vitamin D, hormone D, vitamin D is shown to be neuroprotective, and probably no surprise to everybody, turmeric. Turmeric, anti-inflammatory, decreases the inflammatory process, which usually is stimulated by NF-kappa B. So you set the table, I took a jump shot, it's your turn to dunk.
What was the analogy you gave yesterday about comparing vitamin C, vitamin E, and glutathione? I'd forget. You had something that was brilliant that I took away from that lecture.
It was from Dr. Harris from Omega Quant. He said it because we want to give full credit to everybody. It was great. Yeah. Essentially, for every molecule of vitamin C, it ameliorates 3 free radicals. Vitamin E, approximately 1 molecule, 5 free radicals, and 1 molecule of L-glutathione, 1 million free radicals. And guess what laser helps? With the production and the ability of L-glutathione to get in the cell, because the critical element for glutathione to be effective is to get in the cell. Now, you did something really cool today. Now, we were talking about the cerebellum, because I said, and we were having a little discussion about how many neurons are in the cerebellum. But I hate to say this, you said to me, tell me if I'm wrong, that the brain is all interconnected, so it's good to laser the brain. But you said there's specific parts of the brain for specific properties and specific injuries, for instance, smell?
Yeah, there's a lot that goes into that. I think the one thing that I'm continuously intrigued by is that there's a lot of really cool studies coming out on rats. There's a lot of really good research coming out on different animal models looking at what low-level laser specifically can have and how it can influence the brain. For me, the name of the game, no matter what, is to improve quality of life for my patients, whether that's through structural work, neurological work, metabolic work, or just literally being there to listen to them. And I think this is something that we've lost in medicine, is building that relationship with those patients. More importantly, too, keeping them honest, right? It's a two-way street. We have to be able to effectively communicate, but also to connect with our patients, to know that we're there for them. But it's a loving relationship, and you got to do the therapies. You got to follow up with nutrition. I mean, we have to do our work too, right? We have to make sure that we're staying on our toes and we're not getting stuck in our own ways. And so I think what's beautiful about low-level laser therapy is that in the current state of where we're at in understanding neurodegeneration and the rapid loss of neurons, neuroinflammation is really the name of the game. And it's this whole relationship between the gut and the brain and the gut. It's a two-way street. There was a brilliant article that came out in 2009 in the Journal of Neurotrauma, where they essentially took rats and induced traumatic brain injuries in these rats. And they did cross-sectional imaging of their small intestinal tracts. And what they found was that within 6 or 8 hours of a traumatic brain injury, they saw notable changes in the intestinal lining in the gut of these rats. It's not just the brain and the gut, it's the gut and the brain. It's a two-way street. There's no way to get around that. It's a chicken or egg conversation. It's really powerful because a lot of patients who suffer trauma also subsequently suffer different types of metabolic issues. Now we have changes not only in the blood-brain barrier, we also have changes in the gut-brain barrier. Once again, we don't know which one occurs first. We have different changes in different types of gut microbiota as well. Now, where this is really powerful is when you can utilize different types of therapies that are non-invasive, like low-level laser therapy. You can dampen inflammation. You can increase different types of nitric oxide formation, which can bring more blood flow, more nutrients. This is what's really interesting with the brain injury research, is that during normal activity, let's say I move my right arm, what's going to happen is my right cerebellum, for the most part, my left prefrontal cortex, for the most part, is going to have more neurological activity. Well, they're yoked together, and that's beautiful. When I have more neurological activity in these areas of the brain, I should have more blood flow going to these areas of the brain as well, too. This is the exact same technology of how MRIs work. The problem with a brain injury is that these two mechanisms become decoupled, and they're inverse. And now when I have more neurological activity, I actually have decreased blood flow. Well, this is what's brilliant about utilizing low-level laser therapy, is that you can actually induce greater blood flow by utilizing low-level laser therapy. If I have areas of the brain or areas of the body that aren't coupled together with utilizing neurological and vascular mechanisms, we can try and utilize different types of low-level laser therapies to try and increase that activity and couple them back together. This is really important for the patients, especially early in their traumatic states, because a lot of them are told to do what? They're told to rest. They're told to relax, right? And there's nothing wrong with that. But the name of the game at this point, too, is to also get them physically and cardiovascularly active, because we know the quicker we get people to be physically active, the faster they're actually going to be able to recover. And that doesn't mean they need to start going to run marathons, or they need to really start pushing themselves from a cardiovascular standpoint. They need to just start moving. There's a great way to actually regulate that for a lot of the docs in the field. You can actually use your stethoscope and listen to a functional bruit in the vascular parts of the front of the neck. When you hear the functional bruit, you actually use that as a target heart rate for these patients. You have to base it with symptoms as well, but once that functional bruit goes away, you can get them back to activity. And so now that the cardiovascular system, the autonomics, that dysautonomia that usually happens, that yes manifests as the gut, yes it manifests with the brain, it can also manifest metabolically too. Now you can start pushing them from a neurological and a musculoskeletal standpoint. And Rob, that's a really good point for you too to come in, because at that point now you can start loading their bodies. You can get them back to start doing physical activities. And one of the things that you touched on that I thought was brilliant with the shoulder as well too, is you talked about the implications of this whole vagal, sympathetic, parasympathetic balance. So I think that's really important for you to elaborate on a little bit more, because I think that there's a lot of viewers out there who would like to learn more about what does that look like, what does that entail, but more importantly, how do you actually treat that?
Great stuff. So much to unpack. I agree with I'm going to hit that shoulder. I agree with the rest. The doctors have talked about rest and concussion, and it's wrong. We want to get them moving. We want that steady state exercise. So we don't want to move the head. but we want the steady state. We want them exercising to release that BDNF coming from the gut, going to the brain. What a takeaway. Whatever you do to your brain, you do to your gut. Whatever you do to your gut, you do to your brain. We talked about it before. Post-concussion, you have a 60% chance of having leaky gut and or small intestinal bacteria overgrowth. So essentially, we've heard people say it. We say it all the time. Gut on fire means brain on fire.
Absolutely.
Brain on fire means gut on fire. The superhighway to health is right there. But the vagus nerve, cranial nerve number 10, captain of the parasympathetic nervous system, goes from the medulla oblongata right through the jugular foramen down through the transverse colon. Not to get too technical, inserts on the transverse colon and hits something called a neuropod. This neuropod enables this nerve to actually sense what's going on in your gut. So your gut is communicating, and one of the main ways it communicates with your brain is through this vagus nerve. Now, what Dr. Reese was referring to yesterday was vagal nerve tone, or increasing vagal nerve tone, is critical to get an impact on musculoskeletal health. So we were demoing people who had shoulder issues. We worked on the vagus nerve on the opposite side. When you're able to balance your vagal nerve tone, you have a harmonious output in your musculoskeletal system. So that was a huge takeaway for our doctors here in the Netherlands. Vagus nerve is a critical element. You can do so with the laser. So we purport the EVRL, or corneal violet red laser. Guys have any questions, feel free to reach out to any one of us on that. However, vagal nerve tone is the thing. You'll see a lot of medical doctors now talking about putting in a device in. We do it with an alternative method, an adjunctive method, a non-invasive method, a low-level laser. We use both the violet and the red light. If you haven't had a vagal nerve stimulation, find somebody who has it and have it done for you. I can tell you in my office, when I upregulate the vagus nerve, it's a dramatic change in people's health. In addition, some people actually become more regular with the bathroom. When I say regular, most people think they go to the bathroom because it's a rest and digest nerve once or twice a week. When you're able to stimulate the vagus nerve, you regularly go appropriately, and it gives you better periodic bowel, well, I'll just say it, bowel movements, if you will. Poop. That's the word, right? Isn't that the technical word we're supposed to use?
I think that's what we learned in school, yeah.
Yeah, I heard Dr. Hyman say, it's poop. It's poop, everybody. It's poop. Now, interestingly enough, we're out here in the Netherlands, and we're doing some hands-on. I saw you working with somebody who had an extremity injury in the elbow, and there was a nerve implication.
Yeah, I think one thing that we're finding more and more too that is really not only important for us is, as manual therapists and as musculoskeletal providers, we're always looking at the structure, right? And but the big thing for us too, especially as chiropractors, is that the nervous system is really the end all be all for us. I mean, that was one of the reasons why I got involved in neurology, because I wanted to fix myself. Being a patient first, a doctor second, and an advocate third has really changed my perspective on a lot of this. And so your nervous system is so intelligent and so important. And so, physical nerve entrapments are a real thing, but to be able to clear those up and then look at the continuous flow of how is your nervous system actually functioning. I mean, that to me really is the final frontier that we'll be spending probably the rest of our careers trying to answer is what can you do to help patients update their software? I mean, what does that actually look like? And Rob, you touched on a really interesting thing yesterday too. With this whole conversation about, sympathetic and parasympathetic tone, your vagus nerve, and, we'll just break it down really quickly. Your stress response is your fight or flight response. That's the sympathetic aspect. The exact, yin to the yang of that is the parasympathetic, the rest and digest. This is the vagus nerve component. And so what you want is you need to have both of those. They're really important. So if we were out, let's say if somebody threw a bear in this room, we should have a stress response. That's appropriate. You should have this big catecholamine release of norepinephrine, epinephrine to get your brain and body ready to fight, flight, flee, or in some cases, somebody's going to freeze. But the problem with that is that should go away after a while. When that bear leaves the room, we should be able to relax. We should recover. One thing that I found really interesting yesterday that you touched on was that you wanted to know whether or not low-level laser actually worked for increasing vagal tone. And so you used an objective marker. You used heart rate variability. Heart rate variability is one of the most efficient ways that we have right now to actually quantify whether or not you're seeing changes in the imbalance of the sympathetic and parasympathetic system. When you take a look at the rhythm of your heartbeat, you can actually calculate it based off of heart rate variability. And what that means is that there should be variability between the peaks and the valleys. And I've done this with in my office too, because I want to know if I'm going to do something, or if I'm going to see something, or if I'm going to try a new thing with my patients, I need to know that it's actually going to work. Not only is my reputation on the line, but these people are coming in and they want help. I'm not here to waste their time. They're not here to waste my time. And what's beautiful about that is you can see changes in heart rate variability by utilizing low-level laser therapy, specifically when you're utilizing it with a vagal nerve. And so I think that that's really powerful. I think that's really cool. I think the other thing that you had brought up too is that when you're utilizing the low-level laser, there's also a pretty significant portion of this too that is not just working on a local level; it's working on a cellular level. So the low-level laser is throwing, billions and billions of photons into these tissues. Well, what's going on? This tissue is absorbing the laser. It's absorbing the light that's coming in, this concentrated light. And what that's doing is it's changing the cellular metabolism and cellular mechanisms within the cell. It specifically affects this fourth phase of the electron transport chain called your cytochrome C oxidase. For the docs out there, this is the rate-limiting enzyme for ATP synthesis in the mitochondria. What it's doing is it's upregulating this fourth complex's ability to create ATP. This is a problem because for a lot of people, especially these patients that are on statins, we know that statins actually deplete CoQ10. And Dr. Rob's talked about this endlessly in a lot of his lectures. CoQ10 is a really important aspect for allowing NADH or NAD plus to be created within the mitochondria, to be utilized in that fourth and fifth complex, the end result, to create ATP. Well, if that's ruined, you're actually having significant implications for creating ATP. What do most of these patients complain of? Fatigue, endless fatigue. They're taking these statins to lower their cholesterol, which is a chronic inflammatory process to begin with. Cholesterol is not the bad guy. It's the chronic inflammation that people are actually going after. But now these people are fatigued. Well, what do, right? It's a conversation of how do you balance the therapies, the modalities. And so what's interesting with low-level laser is that it can actually upregulate ATP production. It allows your cells to be able to heal and be able to actually tackle this chronic inflammatory process. It also has anti-inflammatory properties inherently with it. And I think that's one of the reasons why I got involved with it with my patients, is I want to be able to maximize everything I can do with them in the clinic and also outside the office. And Rob, I know that's one of the reasons why you got involved with that too, is because you were not only seeing the benefits, but you were looking for additional ways to help your patients update their software as well.
Right. Yeah. It's interesting. Great conversation point. A really good explanation of what it does at a cellular level. That said, I got it because everybody knows my story. I have congenital torticollis. I need something to treat myself. And man, it was a game changer for me. So, when you do it on your own as a chiropractor, as a functional medicine and a functional movement guy, you want to share it with your patients. And, that smile that patient shares with you when you make that change in their life, when they've been somewhere else and they thought all was lost, it is breathtaking. So without question, and I know you practice like I practice, and, it's not just science, it's science bridge to Monday morning application. Mm-hmm. That laser is applicable. Really great discussion about the anti-inflammatory properties of the laser, in that if I have a mantra, I want to manage and modulate inflammation. Obviously, lifestyle is a great thing. Cut down your sugar, cut down on your gluten, cut down on your dairy. Guys, everybody, GPS, no gluten, no processed food, no sugar, DNA, no dairy, no nicotine, no artificial sweeteners, and watch those vegetable oils. That said, the modality of choice to decrease inflammation is without question low-level laser. The Aconia 635 and 405 wavelengths do that without question, real quickly and efficiently. 20 out of 23 FDA clearances. Everybody's heard me talk about that before. But, the one thing that you said about at the cellular level, the body's all interconnected. So if we're able to imbue the mitochondria with efficiency of ATP, here are some of the good byproducts, not only ATP, but also a reduction in ROS. So we have a decrease in free radicals. So you could actually say that the laser to some form is anti-aging. In addition, we were talking about the brain, mm-hmm. the number one mitochondria organ in the body. We talk, why does it help the muscle? Mitochondria at a cell level. And something else that we were talking about yesterday, let's dig in a little. I know they're giving us some time. We may go over a little bit on time. Let's talk a little bit about the gut. 80% of our immune cells are in a gut. It's where macronutrients are absorbed. I can give my 7R, but we've talked about the laser impact for the gut. So we're going to get into that, but hold on. We got a bunch of questions. Sorry for jumping around, but we've got our man. We've actually got Diane. Excuse me, I pressed the wrong button. She's watching from Wisconsin. And anybody offer low-level therapy in Wisconsin? A lot of people. That's actually one of our biggest states where there's some low-level laser practitioners. So my suggestion is we'll put it in the show notes. Go to Raconia.com, look for a provider. Do you know anybody offhand in Wisconsin?
I know there are a bunch of docs in Wisconsin. So I've done a couple lectures for the Wisconsin Chiropractic Association. I know that there are many, many doctors who utilize low-level laser in their offices. I don't know any offhand, but that's a great follow-up question that we can easily get an answer to. So
yeah,
happy to answer that.
Look at Garrett. So Garrett, what do we got? Wonder TBI if hyperbaric therapy in conjunction would be a complementary approach. Let's make this short and sweet. The answer to that is
we're going to say yes.
Yeah,
absolutely.
We're going to say yes. Yeah. Absolutely.
Now, it's a good question because there's a lot of theoreticals behind it. If you're talking from like a university standpoint, they're not utilizing low-level, or they're not utilizing hyperbaric chamber therapy for chronic concussion symptoms, but they are utilizing it for acute brain injuries. They're also using it for diabetic neuropathies. So there's some interesting discussions going on in this space. I'm a big believer in being a little bit bullish on therapies and trying them in the clinic. If there's a minimal opportunity to actually harm the patient, there are a lot of clinics that I know who are working with concussions, brain injuries, anything really dealing with the brain that are utilizing hyperbaric chamber therapy. I've seen changes in my quality of life by using it. I would love to have one day. So if somebody wants to sponsor Dr. Rob and I, that'd be great. Awesome. But it's a great question, and I'm a keen advocate for utilizing that along with other therapies, right? And Dr. Rob has mentioned structurally, neurologically, metabolically, and even emotionally. We have to support the entire nervous system as a whole. But getting more oxygen is always going to be a good thing. And that's one thing that's really interesting about low-level laser as well, too. When you have these photons going into a cell, what actually happens is that there is a response that happens within the cell that actually releases nitric oxide from receptor sites. Oxygen actually binds to these receptor sites in exchange for nitric oxide. Well, that nitric oxide is beautiful because it actually has a local vasodilation effect, which brings more blood flow, more oxygenation, more nutrients to the area that's being affected. And so you have this unique aspect of oxygen, this anti-inflammatory effect, this nitric oxide rebound as well too, but then you have the anti-inflammatory effect, like Dr. Rob said, about reactive oxygen species. Well, two major markers that are really important for us and for a lot of the functional med docs out there, we're looking at interleukin-6 and tumor necrosis factor alpha. These are two very, very well-documented molecules that are decreased, if not inhibited, by low-level laser therapy. Of interesting note, 30% of the interleukin-6 that's produced throughout your body, let's say we ran a blood panel right now and we looked at your interleukin-6 markers, 30% of the interleukin-6 created by your body is actually created by fat cells. Well, why is that? Fat cells are inflammatory. What do we have as a problem in the United States? But like 42% of the United States population is clinically obese, and a majority of them are just clinically overweight. This is a big problem because not only are we inflamed on the front end, but throw trauma on top of that, and you have an entire new inflammatory cascade on top of that. And this is what we're seeing. And Rob, you touched on this yesterday too. Yeah. People are coming in with a baseline low level of inflammation. You throw on trauma, whether it's a torn ACL, it's a concussion, it's some sort of slipped disc, and all of a sudden everything's on fire. You have this rapid response of inflammation throughout the brain and the body. And what can you do about it? Well, you got to take multiple approaches to it, but one of the most efficient things that we've touched on today is you can utilize low-level laser therapy. It's a very, very easy, quick, non-invasive way to dampen that inflammatory response, get people to eat well, sleep well, move well, and think well, and you got a recipe for success. So that was a great lecture you did yesterday talking about that. And I was surprised when you brought up the fact that they're actually doing vagal nerve stimulation to treat rheumatoid arthritis. I think you should touch on that because it doesn't make a lot of sense on the front end of it, but on the back end, there's actually a lot of brilliance behind that. So I would love for you to dig a little bit more into the anti-inflammatory effects of why utilizing vagal nerve stim and low-level laser can help those patients.
Well, thanks for the softball.
I got you.
Yeah, there's a 30% decrease in cytokines when you increase vagal nerve stimulation. So there's direct correlation with the decrease in cytokines, which are inflammatory. Everybody knows about the cytokine storm because of COVID, and a decrease in rheumatoid arthritis. You made a great point about the interleukin. Interleukin 1, interleukin 6, and TNF alpha are elevated in most of our lower back patients. So now we're seeing, because we're able to attenuate lower back pain with the laser, that attenuation is occurring not just at a muscle level, at a cellular level, but it's also working at an objective blood level. Now, you also had a great point on the laser, what it does, ATP oxygenation, neurotransmission. We use the basic idea now. It helps with cellular communication and cellular regeneration, cellular communication through the cell membrane and the nerves, cellular regeneration because of that ATP and its wound healing. But that interleukin-6 was great. We went into detail on that yesterday. 75% of Americans overweight or obese. 12% of Americans are only metabolically healthy. The key component to that interleukin-6 and fat is visceral fat. That's a fat that goes over the viscera. That visceral fat is so detrimental, it damages the blood-brain barrier, and it can also damage the gut barrier. So again, all these things we're talking about can be helped by the addition, the application of low-level laser. And lastly, the vagus nerve, man, we could talk about that all day long. Vagus nerve has an inflammatory reflex. It decreases peripheral inflammation. So its main two purposes are, as we said before, the rest and digest and decrease peripheral inflammation. And we're getting this sign that we got to wrap up. So Simon's going, we've gone over. It's been great. It's Saturday on Memorial Day weekend in America. I'm out here in the Netherlands. I've got functional neurology expert right next to me. Hey guys,
where's that hand
right
coming
over
from?
Hey,
That's
what's going? We're sitting right here. We're splitting a mic. We're having a great time. Everybody, Dr. Eric Reese. I'm Dr. Rob Silverman. This is Proven Health Alternatives. Always yours in health.
Have a good day.